went from the bonnet, found face down on the floor.
2, 3.
Pediatric trauma
It's a stabbing, Cordred.
25 feet from a ladder onto his back.
He's really unwell, and I think anaesthetics need to see him before he goes to theatre.
Daphne? Daphne?
How is everybody then? Chilling?
King's A&E, how can I help?
King's College Hospital, London.
I got stabbed.
I know, it's annoying.
My head.
One of the busiest A&E departments in the world.
I want top to toe, head, chest, abdomen.
A place where love, life, and loss
Don't bloody die. I love you too much for you to die.
unfold every single day. All the patients you're about to see were treated in just one 24-hour period.
A&E is always like a traffic jam. Can we get a trolley?
You've got to realise that there's awful things that can happen to you.
I'm so sorry.
Life is unpredictable, so it's important that your nearest and dearest know that you love them. You have to tell them that you love them.
You must get better and come back to me. I don't want to lose you.
Because there may come a time when you're not around to tell them.
Have we got plans for everybody?
Tristan, you mustn't do that.
Just looking.
Touch things, please.
How you doing, Liddy?
Hey, you.
How you doing?
All right, thanks.
Are you out of it on that Antonox?
Yeah, I'm doing well.
All these tattoos you've got.
I know.
You're obsessed with flowers.
No, I'm obsessed with Michael
Let me see.
Jackson. These are 3 of them are what he autographed on me.
He autographed them?
Yeah, so like this is the first one, this is the second one, and this is the third one.
Oh my gosh.
Oh my God!
Oh! So like you went to see him and you got him to sign his arm and then you didn't wash it off and then you went to a tattoo artist. Wow.
Well, the second one...
I think whenever you walk into an A&E department with an injury, it's really important to have someone there for you that you either love or someone that you have a relationship with or someone that, you know, you share a room with or have spent some time with. Makes the whole situation a hell of a lot easier.
All right, love. Well, I'll see you later. I'll come and check on you before I go home. I'll give you another little moment. Oh!
You are really good at that.
I've got 2 left feet, darling. I couldn't dance to save me life, I tell you. I can't even do the moonwalk.
I think everybody needs someone. It's unfortunately not everybody has somebody, and that's where we are. You know, we fill that little space where no one else is. A&E Kings. 2. Right. Thanks. Bye. 2 adult trauma red phones, 10 minutes. 2 adult trauma red phones, 10 minutes. Could you just tidy 2 and 3? Yeah, we got red phone. We're 19-year-old and a 31-year-old involved in a head-on collision. Don't know how fast they were going. Right, get that one out. One out.
2 female drivers have had a head-on collision. They're both brought to King's by the Helicopter Emergency Medical Service.
The other one's there, Jen.
9, please.
Jen, I'll take this one because this one's the worst.
One of the women has a broken collarbone, but doctors are most concerned about 19-year-old university student Ashley, who was trapped in her car until the emergency services arrived.
piece of handover.
2 secs. You do top end, you do primary survey, I'll lead, OK?
This is Ashley, 19-year-old. About an hour and a half ago, she was involved in a high-speed head-on collision with significant intrusion into the driver's side with mechanical entrapment of her legs for about half an hour.
OK, so she's the driver?
She was the driver.
Yeah. Entrapped for 30 minutes, did you say?
Entrapped for 30 minutes by mechanical entrapment of the legs. And not there, up there. She was actually like
Sam, can you pull the curtains for me, please? Ashley, keep your arms still for me, sweetheart. Good girl.
If we've got a road traffic collision, we're expecting lots of different injuries. Some that you can't see, and some could be to do with their bones, but if it's high speed, it can be devastating.
Keep still for me.
We're going to have to choose. So
Yeah.
Ashley. All right, darling. Oh.
I'm going to undo the collar.
Oh. Ashley, give me your arm.
If someone's showing signs of agitation, it could definitely be to do with an injury to their head. A potential brain injury can change your personality immensely.
Ashley, you're in the hospital, darling. We're going to make you feel better, all right? Sweetheart.
Right. I've got that. You're going to do cryoid. Good. And you're immobilising.
Yeah.
Due to her agitated state, the medical team need to sedate Ashley so that she can be stabilised for scanning.
That'll do. If not, there should be a
I'm going to give her a big slug of midazolam now, OK? So she has 5 of midazolam.
Escorted by police, Ashley's parents are making the 60-minute journey from their home to King's.
She was always my ray of sunshine. I was cooking roast chicken, carrot and swede to mash together, potatoes and sweet corn. We were all getting ready to sit down to have Sunday dinner together. That's where Ashley was to come home for Sunday roast.
Let's get the collar back on, blocks back on, I'll free you up and you can take some blood.
I was about to carve the chicken when she had an accident, just round the corner, 2 minutes away. I literally just dropped everything, told Angela I'd phone her, let her know what was going on, and then I just rushed out the door. Because you just think the worst in case the car catches fire or something, or no, would I be able to drag her out of it? Police turned up, fire brigade turned up, and they started cutting bits of the car away.
Did you see the picture of the car? Completely, yeah, wrecked.
I'm just surprised she's got contusions. She's not very vocal neurology, but she's acting as a contusion. It was frightening. Not knowing what if she'd broke her back or that's, you know, you don't know what damage she had done.
She was a fantastic child. She used to like astronomy. My dad actually bought her a telescope so that she could look at the night sky with him. As Ashley was growing up, I didn't have to persuade her to do her homework. She was very conscientious. She's always loved animals. She's been pulled towards being a vet.
This young lady's been involved in a head-on collision with a lady in number 1. Separate cars. Don't know how fast they were travelling, but complete decimation of the cars. We've only just done a primary survey.
My mum always said to me, appreciate what you've got, never take anyone for granted. You've got to realise that there's awful things that can happen to you and there's life-changing experiences that can happen in the drop of a hat. You could walk out the door and may not come back, or you definitely might not come back the same way.
We've got somebody here who needs a full-body CT, please. When she got here, she had a GCS substantially less than that and was very agitated, so she's been intubated, ventilated. We'll be ready in probably about 10 minutes once we've got off the scoop and done a few other things.
With no obvious external injuries, the doctor's main concern now is possible damage to Ashley's brain.
I had a quick chat to the family, just told them that we were going to CT. We don't know anything. We've had to tube her because she was very confused when she came in. And I said we'd come and tell her as soon as we come back from the scan.
My biggest worry was that Ashley would lose her fantastic intelligence. She's worked so hard, 16 GCSEs, 4 A-levels, to suddenly think that she wouldn't be able to finish the course that she's studying. It absolutely terrified me. Injuries you can overcome, but if you injure your brain, that's a completely different setup.
Veterinary student Ashley is having a CT scan to find out if there's any life-changing injury to her brain after her head-on collision with another car 2 hours ago. Ashley's mum, stepdad and dad have arrived. They're waiting outside for the scan results.
Text Ian to let see if you can let the manager at Dartford know. So you ain't got to worry about the hassle of work. You're stone cold. You know, you get an awful shudder through your body, and it feels like the world's just about to end. You know, it makes you realise that maybe you don't see enough of them at the time. So.
Ashley was 7 when we split. She was quite angry, I think, that her father and I couldn't work things out.
Ash is my first daughter. When she was growing up, it was very lively, always reading books, you know, and always questioning things, you know, why is this, why is that, how's this work, how's that work? Very happy-go-lucky child. I still saw them quite a lot after we initially split up. But as our lives have gone separate ways, you know, the contact's obviously got less. It's hard.
You're going to wake her up soon?
I'm not going to wake her up in ED. No, wake her up in sleep time, otherwise you'll just be in the same situation you were in before.
Hello, I just hurt my nail. You know what? I don't know what happened, but I knocked my hand the other day. When I woke up this morning, it was proper swollen and hurting and stuff, so I think something's wrong. I come A&E, innit?
So you get bloody freezing rain here, bloody cold. Yeah, burping, freezing cold.
Hello, King's A&E. Popped up for a minute. What's her name? She fell out of a tree. Fell out of a tree, yeah. Yeah, and we'll call Kate.
The ambulance service are transferring a patient with a spinal injury from another hospital.
Oh, hello. It's a trauma consultant. Your spinal injury patient's just arrived in recess.
While her son was spending the weekend with his dad, 38-year-old shop assistant Stacey was at a party when she fell from a tree.
Guys, are we ready?
Yeah.
This is 38-year-old Stacey, who at 8 o'clock this morning fell approximately 5 feet from a tree onto her head. She was taken by ambulance to the Prue, where it's discovered she had a C, 7, 8, 9 and 10 fracture. They've cleared her pelvis, but she has got a loss of sensation and movement to her lower limbs.
Stacey, there's like a lollipop, so you wipe it around your mouth and have a bit of
So
stuff
what
on it,
are we doing up a tree at 8 o'clock in the morning? Divorce party? That's new. I've had a very quick look at the images, the pictures they've sent over from Bromley, and it does look like you've got some damage to your back there. We're going to re-CT the whole spine, chest, abdomen, pelvis.
She's the absolutely crazy one. I'm the boring one. If it's going to happen, it'll happen to Stacey. I saw her the night that she was going to the party. I went round to her house. She was going to go, and then she wasn't going to go. And then I said, you're sitting here on your own. I'm going home. Go to the party. She said, but I've got work the next day because she had work on the Sunday. I said, yeah, it would be sensible, have a couple of drinks, come home at 11. No. It was an all-night party. And the accident happened in the morning.
Her friend Laura and ex-boyfriend John followed Stacey to King's when she was transferred.
Who's next of kin for Stacey?
You or me? Who's your next of kin?
Who wants to be it?
Take your pick. Me or John?
You can both be if you want.
Yeah.
I think they was all taking it in turns to see who could climb the highest. And, of course, Stacey went the highest. Stacey looked all glamorous as well before she went.
She was going on about how nice that dress was last night.
Any more?
Whose dress?
What?
She was going on about how nice that dress was last night.
It was. It ain't anymore.
Did you lend it?
No, thank God. Cut it off, didn't they? Yeah, it was her dress.
Was it a new one she bought?
No. She's had it ages.
Oh, where can I afford to buy dresses? I've bought you so many over the last 3 years.
No idea where she gets her positiveness from. I really don't know. I've never been like that, so I don't understand it.
Do you want any more?
1, 2. 2 times, and then next 3 times.
Oh my gosh, I like it. 4 times.
Oh!
Let's start again.
Oh, okay.
I really want to kind of eventually move out of London, be closer to my mum and dad. And they're only an hour and 20 minutes away, but they ain't getting any younger. And especially when you have kids, you kind of realise how important it really is. Do you know what I mean?
Hi. She's got Michael Jackson's signature tattooed on her, signed by the man himself. Look, look. Look.
You mad?
No, she loves him.
And he loves me too.
And he loves her.
Looked into my eyes and said it on more than one occasion. Oh, do you know what? I have to say.
Did he? Did he?
Once, there was this time.
Oh, wait, listen, you didn't go all the way, did you?
He was a very sexy man.
Well, I know, of course he was.
Sexy. You do that too well.
You've got to give people a lot of time and give them your attention and your love. Because even unconsciously, just to be touched or to be spoken to definitely settles them. I do believe that even if someone is unconscious, they have a tube down their throat, breathing for them, and a relative or a loved one comes in and holds their hand, their heart rate goes down. Even, you know, people that don't respond, they definitely respond well to touch.
Mum and Dad, do you want to come through?
Bless her.
You can talk to her. I do.
Can I touch her?
Yeah,
Is that all right?
Oh. Yeah, Ashley.
Although her CT scan shows no obvious internal injuries, Ashley is still under sedation, and doctors will wait until she is woken up in intensive care tomorrow before confirming the results.
All sorts of thoughts go through your mind. You want to be able to take any pain away that they may be suffering. You love them so much that if you could swap places, you would. We've got some pyjamas for her. I don't know whether they can. I know she can't put them on at the moment.
Not at the moment. What's going to happen is that you're just waiting for a bed to be ready on ITU.
She's so tall, isn't she? Well, I hope she takes after me in a lot of ways. That would be nice.
PlayStation, Xbox, computer games and things like that she definitely gets from me. The brains, she definitely gets from my mum. Angela got married first. She settled down with Paul before I settled down.
You all right? I'm the evil stepdad. So, no, we've got 4 kids. I hate them all the same. I'm close to all my kids, so just a dad, really.
It's all caution.
I know.
Yeah.
It takes a lot of getting used to, especially if your kids think they've got you to themselves and then all of a sudden you bring someone else in.
What's lunch? How many are you getting it? Remember the packet used to be like that?
There was a danger of actually falling in the packet when you were in. They were 7.5p as well, weren't they?
They used to be like 3/4 of that, on the top.
So this poor lady, she is Stacey Anastasia. She's from the Peru. She basically came as a transfer. She fell out of a tree this morning onto her head. She is going around for a head, complete spine.
Want some oxygen? I don't know what to do. Hey?
I don't know why she split up with John, really. It's a shame, because they are such a good couple. I think a lot of stress.
Your oxygen's all right.
It's going down a bit, John.
What do I do if you put it on?
Oh, that's better.
Yes, it didn't go up at all. They two were very close, but both very hot-headed. That's it. So if one of them had a problem, they wouldn't talk about it, it would be a row.
Stacey, I'm just going to touch you different places. I just want you to tell me if you can feel me, OK? OK. So try and wiggle your toes. Are you trying now? Can you hear me all right with those blocks on? So shout as loud as you can if you can feel me touching.
Listen to the nurse, Stace.
Do you feel me touching?
No.
And here? Okay. And it's about there, isn't it, where you start feeling it? So here. Okay. All right, perfect.
Fine. How did that go? All right?
She can't feel. She can't feel anything from her hip down. She can't wiggle her toes.
Right, she's paraplegic.
I think she just thought she was going to be OK. I don't think she realised the damage she'd done.
All right, sweetheart. Let's get you round. No. We need to just go around and scan.
She really didn't realise she'd broken her back. I didn't either, until the doctor came round and started sticking pins in her feet. And that's when I realised she couldn't even feel them. She couldn't feel her feet at all. That's when I really did panic, because she didn't even know they were doing it.
Stacey is being taken to the CT scan to find out how serious the injuries are to her spine and neck.
Can we please have 2 members of staff to Golden Jubilee CT for Lockwell? Thank you. We all do silly things. We've all been drunk. We've all climbed trees, but it's only 2% or something that fall out of them and end up in A&E. Can we try and rearrange this collar?
Yeah, let's do that now, actually.
I think that things in life are unfair, and I think if you think about why it's happened to one person, why it's not happened to another person, you'll go absolutely crazy. Sometimes rubbish just happens to certain people.
You're right. Your back's hurting, is it?
So we're going to roll you and move you across and stuff. You going to be all right? Or do you want some more pain relief?
I'd like some pain relief, please.
I think we're going to need to give you a bit of stuff before we move it. So you're not very happy. Let's give you a bit more morphine. We'll give you a bit more stuff before we move you, okay?
Oh, you know, Beyonce's baby, they showed a picture of the baby. Papa looks like JC, nothing like Beyonce. The shape, face, the lips, the eyes, everything. It's the spit of JC.
How long have you all known each other for? Forever?
Yeah.
Stacey is waiting for the results of her CT scan, which will show the severity of her injuries.
I'm a crisis friend. When anything happens.
Are you prone to accidents, Stacey?
Or anything, to be fair. Not even accident, anything. Yeah. I've known Stacey for 15 years. We see each other every day. Because we've got horses at the same stables, so we see each other every day, go up there and have a natter. We kind of got together when her mum died. She nursed her mum, but she was very together. You don't see her cry very often. She's very, very brave.
Hello. Hi there. You all right? Yeah. I'm one of the trauma consultants working here. Stacey, you all right? Do you don't mind me just chatting to your friends? You fine? Okay. So I've just had a look at the scans of your back. So you've broken your back in 2 places. So that's the bones. The bones don't matter, really. What matters is the spinal cord that sits underneath the bones. And obviously, Stacey, we're obviously concerned, and I'm sure you're concerned as well, that you've got no feeling in your legs at the moment. So what we're going to do is put you through another test called an MRI scan, okay, that lets us get a very clear idea whether there's been any injury to the spinal cord, and if that has, how bad that injury is, okay? And that will decide whether we need to do anything urgently in terms of surgery to sort of stabilise your back and stop things getting worse, okay? I'm sure you want to know what's going to happen, you know, whether this is going to get better. I can't tell you at the moment because I genuinely don't know. Only time really will tell that, and more information that we'll get from the next scan we're going to do. We'll do. Okay.
So I was thinking, what is she going to do if she can't walk? Who's going to look after her? Because I just don't know. I was her next of kin in hospital. She hasn't really got anyone, not family-wise. Calm down, do you want some oxygen? Do you want some oxygen? No. I think where she's obviously had to get used to it, where she said, no, Mum, her dad lives far away, so she doesn't really see her dad. We didn't even know how to get in touch with him that night. So, yeah, all she's got is friends. I knew that I was responsible. It was scary.
Peter was brought to hospital 2 hours ago with abdominal pains.
Let me just ask you first, your pain in your tummy and the swelling, how long has that been there?
Well, it's been a reoccurrence. I've been twice into King's,
Yeah.
and it started again recently.
Right. So how long's it been like that?
Well, since I came out after the endoscopy thing, you know.
Yeah, endoscopy. So you're saying about your diet, are you just drinking, not eating food, solids?
Well, I'm trying to eat, but I found bachelor's chicken soup had helped me a great deal. Hot.
Yeah.
I like Andrew's liver salt.
You must be in the minority there.
Is it? Well, it's good for the
I know it's good
stable.
for having a little clean out.
Yeah, and then I like my milk.
Yeah.
Because that does help, you know. No, I've been very lucky. I've been around the world 4 times. twice on the motorbike, twice on the car.
On the motorbike, yes.
Yeah.
That's something.
That's life without a wife, and even worse with one, I'm told. Got 40 mates of mine married, divorced, and I'm still single. Still looking.
Still looking? Well, there's no harm in
Intelligent,
that.
good-looking, who likes me.
I know.
Do you think it's possible?
Oh, well, there's someone there. There's a little lady somewhere.
I never thought I'd be alive this long without being married. Thought I had children by now, and didn't happen.
Right, I'll just print that off, and then she come in and take some blood from you, and then we'll see the doctor.
She's not taking it literally.
No,
Not
little
a
needle.
Point. Not a point.
No, not a
That's
pot.
all right. Haven't got much in me. Thank you. I'd like to. A lot of people say, I wish I could marry you instead of that rotter. I say, well, you shouldn't have married him, you should have married me.
If you to have a drink, you want some tea or something?
If it's possible.
Yeah, you have sugar.
Two.
2 sugars.
Thank you. Oh, dear. I never got close enough to anybody that was similar, you know. Like, I'm easygoing. I don't drink, I don't smoke. I don't gamble. Well, I'm horse racing and things like that, the usual. Nothing expensive.
There's no sugar, I'm afraid. I might need to go and whip some from somewhere.
No sugar?
No, I've got...
It doesn't matter.
I'll get some anyway.
Don't worry, don't just go out.
That's fine, don't worry.
Is that what you call tea? Ooh, it tastes horrible. No sugar.
Stace, why are you so tense? I need you to relax, yeah?
Stacey will shortly be going to the MRI scanner to find out if her paralysis is permanent.
I'm really scared. Yeah, I know. Listen, everything's going to be fine. Stace, look at me. You're going to be all right.
What's wrong? Yeah. Sweetheart.
You won't, because you're going to sing to yourself in there. You'll sing.
Eh? Yes, I know you are. Stace, come on, darling. We're here, aren't we? Stacey, look at me. Stace, look at me. Stace. Stacey, look at me.
Don't cry, because you're losing even more fluid.
Come on now.
It's okay, Stacey. I need this hand to be still, otherwise you can't have the medication, sweetheart, okay?
Nurse Emily is giving Stacey some medication to ease her panic attack.
Are you starting to feel that a little bit?
Yeah?
You okay, Stacey?
Wow, that's amazing.
Just gonna give her a tiny bit of oxygen. Bless her.
I can't believe this. Can't believe this.
It's just one of those split-second decisions, isn't it?
Worst nightmare.
Over 70 over the hill, what do older people contribute? Both Nelson Mandela and Winston Churchill were over 70 years old when they were eminent leaders of their countries. Ageism is everywhere and can be so insulting.
Before it used to be over 60.
Yeah, but there were leaders over 70, but they weren't doing any manual work. I saw on London tonight there was this man over 100 and he was still working in the office. Over 100 and still working, bloody hell. And there's people like youngsters that can't even be bothered to find a job. They should be ashamed, really.
Yeah, but that's the generation, isn't it?
What is the new generation going to be like? It makes you think, innit?
Hello.
Hello.
I'm Amanda, I'm one of the technicians. Just pop your arm straight so I can take the blood and pop in the tube, OK?
Hello, Amanda. Hello. Am I going to be dead or alive when I finish? I was born in 35, right near the war. We lived in Austria. Mother was studying the doctor in Heidelberg, right? And I lived with her uncle and aunt. The Germans came in 39, as you know, and walked in. I mean, not necessarily declared war, but the Gestapo just came in, you know, and boom. You and you, there, you and you, cattle trucks or whatever it was, and you disappeared. It seems so strange. All these things, I've never been ill in my life. As I said, I was in the concentration camp for 6 years, never was ill once.
Did you?
And I weighed 3 stone when the Russians released me. I had blonde hair, blue eyes, spoke German, Russian, Polish. Mother was Polish.
Well, you've still got the blue eyes.
Yeah, they're still there somewhere.
A little bit lighter, shall we say.
There aren't any next of kin. I'm the only one left. Mother died. My father apparently had been killed just before the end of the war, so I never saw him again. So really, I'm on my own. Not much I can do.
Busy life you've had, haven't you?
I'll get something. Do you want a pillow? We haven't got pillows, but I can do your blanket at the back of your head.
No, it's all right.
You
quite
sure?
comfortable. Yeah, thank you. Thanks for your help.
All right.
We're not going, are we?
We are. Stacey! We're going to take you round to scan now, OK?
Although Stacey's CT scan showed no damage to her neck, doctors are still worried about her spinal cord. She'll now have an MRI scan, the results of which will tell doctors whether she'll walk again.
My worst case scenario for myself, for my family, is for any form of ability to be taken away. So if any of them broke their back and they were in a wheelchair, if any of them lost their sight, their hearing, anything like that, it would be, for me, the worst case scenario. Just every time anyone comes in like that, my heart absolutely sinks.
Responsive. Hello. Hi, my name's Michelle. I'm one of the radiographers. We have to do a quick MRI scan for you today. The MRI scanner is very noisy.
I do like to experience different things in my life. Me and Laura went to Ramsgate last year. We had a brilliant time. It was in the winter and it was snowing, and we took our shoes and socks off and went in the sea just to experience the cold sea. You have to have an exhilarating life, you know, and just go for everything. I mean, you know, because that is what makes your life. And then deal with the sort of consequences afterwards. But then you have that, you know what it feels like. So I'll always know what it feels like to feel a freezing cold sea on my feet.
How are you getting on in there, Stacey? Are you still okay? Lovely, you're doing ever so well. Just be quiet for a moment while I plan the first scan. What do you think of the top of the C-spine there? 2, 3, 4, 5. All right, okay, bye. The C-spine is degenerative change that he said about, so it doesn't need any further imaging, so that's fine.
So did he think it was just swelling as well?
Yeah, he said it doesn't look like anything.
Well, that is good news.
It's good news.
She had a nice little nap.
Okay, thank you.
Cheers, thank you very much.
Stacey's back from her MRI scan.
Yes, so they're still waiting on the report, but on the scan it doesn't look like there's any major compression of there. Obviously, when there's any type of fracture, there's some swelling around the bone. They were saying that they think that it's going to get better and better with reduce of the swelling, and that obviously there isn't any massive spinal cord injury. So it's the best outcome, really.
Good.
So you're a very lucky lady.
Very lucky. Very lucky.
Okay.
You always will them to get feeling back.
Thanks for everything.
No worries.
When they say, I can feel that now, all of a sudden you get these butterflies in your stomach. You think, oh my God, this is amazing. This may not end up to be the awful story.
On that side, John. Scratch. Don't watch it to the back. Or if I do this, could you just stick to the bottom of my back? No, fucking sit still. Don't be so stupid. Don't be such an idiot. So scratchy. John, can you reach my leg again, please? Please, love, just this one. Please. Why is everything so hard for you, just to scratch my leg?
Because you want us to itch you constantly for an hour.
I'm really itching. Just itch it. Yeah, there. Just scratch it really hard. Can you do 2 hands?
No.
Please, John. Please, I fucking can't do anything.
Is the morphine making her itch? Yeah.
Really, really scratchy.
Driving us crazy.
She's coming back to normal.
I don't like normal, Stacey.
Stacey, moving your back.
Shut up. No, you shut up.
No, I'll tell you what, you're fucking taking a piss.
You are, you're being stupid.
I'm taking a piss, I'm itching. Don't talk to me like that. I'm itching, I don't really understand. I miss them not being together. I think Stacey secretly does love him. She's gonna kill me for this. I don't think you realise that it's fucking...
Your back is broken and they're telling you to lay still and you're arching your back.
John, if you was in my position, I've been through enough today. I don't need you having a go at me.
No, we didn't work as a couple. It was just too much arguing. But, you know, there's always someone out there for everyone.
OK, we're going to take you round on the trolley. And if you don't mind, they're going to transfer you onto their trolley when you get round there, OK?
I have to be realistic. If somebody came along, I mean, I've had offers from younger people, right? But I don't think that would be sort of practical. I am getting on a bit.
What about my stuff? Have you got anything valuable in there?
Of course I have.
OK, take it all with you, OK? OK, leave your jacket here, because your jacket will be fine.
No, well, it's valuables in that.
All right, OK.
Never should part.
How lucky was that?
What?
You.
Thank God for that. No, I'm concentrating on getting better. Can you believe I broke your back?
In 2 places.
Mental, isn't it? Yeah. Thanks for coming down, Don.
Well, you know I'll come down, eh? I'm going to let you go through this on your own, am I?
I think she's been shaped by all of us in our own way. Whatever she ends up doing in her later on in life, I will be proud of her.
I see her not as much as I'd like to. I'd like to see her more. And I suppose that's down to me to make the time and the effort to make sure we see each other.
I am very, very lucky. I mean, family's the world to me. There are lots of things that go on, good and bad, that they've helped me with. So, no, I am very fortunate to have them.
She does make a nice cup of tea, but she never likes putting sugar in it. Never lonely. Got plenty of things to do. I'm an uncle to about 20 kids, unofficially. Friends of mine are married, and of course I'm Uncle Peter's going to be, you know, part of the family, sort of thing.
All I've got to do is learn to put this on myself and then I can start walking around. The sooner I start moving about...
And what happens if you ever fall? Because
I won't fall.
I can't hear you.
I'm not going to fall anywhere. I'll have helpers and stuff, but once I'm steady on my legs, I'm going to be fine. There's no point in me staying in the hospital. I've just got to get strong and up and out. I think I'm lucky because my luckiness counteracts my unluckiness. So all the unlucky things that happen to me do seem to counteract themselves with a bit of luck. So I seem to manage to get out of them somehow. I think I can stand.
Really? Oh.
About that eye, I think.
Yeah, sit back down then. Don't look at it. Can you feel your feet?
Yeah. Riding horses for so many years and falling off, like, you know, you put your body out of sorts. And I have had a bad back for quite a while. I used to sort of go into bed and get up in the morning. It would take me ages to get out of bed because my back would hurt. But since I've done this, I just spring out of bed. So I think it's probably realigned my spine. I don't know, but I don't have a backache anymore.